Welcome everybody and welcome to the VDM Project presentation. My name is Fabio Gallerani. I'm going to be the host of this webinar. Here with me there is Dr. Seberg. Hello, doctor. Can you hear me?
Yes, I can. Hello, Fabio, and hello to everyone on the World Wide Web. We're very pleased that you joined us for this webinar. My role in this webinar and in the VDM project in general is to provide the scientific basis for our understanding of vitreous and the origin of vitreous floaters. We realize that the majority of our audience is sufferers, people who have eye floaters, but I will nonetheless present the scientific perspectives because I think it's important for everybody to appreciate that there are sound scientific underpinnings to our ways of thinking and managing eye floaters. I won't dumb it down, but I'll try to make it understandable for everyone in this heterogeneous audience. So thank you, Fabio, for organizing this very nice webinar.
Thank you, doctor, for being with us tonight. So I'm going to share the slides for the presentation. Can you please confirm me, doctor, that you see the slides right now?
Yes, I do.
Okay, so I'm going to make a brief presentation of what we're going to discuss in this webinar. As the doctor said, we're going to go into explanation of the condition of eye floaters and also what we can do about it. And you're going to discover in this webinar how to support the project created to connect eye floater sufferers and research foundation in a single unified movement, a movement born to achieve clear vision. And this is I'm very excited tonight because this was a vision I had, and you're going to learn about my story. You're going to learn about also Dr. Seberg's background in this condition in the ophthalmology world. So who should watch this webinar? If you are an eye floater sufferer and you want to help research in this field, move ahead. You should watch this webinar and stay until the end. If you are an eye floater sufferer who have decided to take action rather than complain and spread hate on the internet, you should stay till the end of this webinar. If you are an eye floater sufferer who believe it's time to unite, to support research, to speed up the discovery of a better diagnostic and less invasive treatments, you should stay until the end of this webinar. And also, if you are somebody who knows someone with eye floaters and want to support them, you're going to learn how to do so in this webinar. And if you are a philanthropist and you want to make a difference in the life of others by supporting research efforts in this field, you're really welcome to support the VDM project. What will you get out of this presentation? Well, you will be able to know the mission and the vision of the VDM project and why it is important that you join this movement. And also you will understand exactly the status of eye floaters research worldwide. You will clarify any doubt regarding your condition's existence. And this is very, very important. And you will be better able to cope and bring positivity back into your life. And this maybe is the major reason why you should be in this webinar with us tonight. You will be able to achieve peace of mind, knowing exactly what's going on inside your eyes, perhaps making it feasible to live with this condition. And also you will learn about available cures, and today you discover the paths to better eye floater evaluation and treatments tomorrow. And very, very important point, we are all here hoping there is something moving in the research, and there is. So you will learn about it in this webinar. You will learn how you can be part of the VDM project and not just waiting and watching what is going to happen. So who I am and why you should listen to me? Well, I am a high floater sufferer. I am an entrepreneur, and I consider myself since 2019 a philanthropist because I love to give back. When you achieve success as an entrepreneur in any field, I believe the next step is to help others. You should help others also when you are an entrepreneur with your product and service. But also I believe that you reach some point in the life where you should just give back and do all your best to help others live better. So Who I am an entrepreneur, as I told you. I am a marketer. I am an entrepreneur in the marketing space, especially digital marketing. And I founded Marketing Genius in 2016, which today is a movement of 35,000 entrepreneurs and professionals. And I also founded the All-Inners movement, which define the avatar of my customers. All-Inners derives from the word all-in. That means that you shouldn't have a plan B in life, in any project you try to achieve. So I'm going to speak about this movement and the reason why I decided to create a movement also in this condition, in the eye floaters space, because I believe a movement is the solution to create something that was impossible before. I also was pleased to write a book called All-Inners to inspire everybody that has an idea, that wanted something more in the life to achieve it. And this book went bestseller in Italy. And the payoff is, in life you have two options: or you give up or you go all in. And the same is with eye floaters condition: or you give up or you go all in, and you support everything you can to fight this situation and unite with others to make a difference. I also was pleased to become a university professor for the Marconi International University, since I really believe that education needs improvements, especially in the university space, in marketing. And in 2019, I was awarded as one of the top 100 educational leaders worldwide for the impact that my methodology had in the students. So I always focus on others. How can I impact their life? How can I make a difference? And now I'm going to introduce Dr. Seberg, which I consider a very special person, a special person behind a real important professional in the ophthalmology field. Dr. Seberg is a fellow of many institutions and organizations, and most of all is one of, or the one that has the most experience in vitreous research in the world, in the ophthalmology space. He has partnered with us with the VMR Research Foundation, which is his non-profit organization that strive to make improvements in the better understanding of the vitreous conditions of the eye. And he united with us in the Vdm Project to promote education, to develop understanding and help coping. Here there is a little I miss a letter, but you can understand, and direct action to support research and development, better diagnostic and cure for these conditions. His past is very simple to resume. He is 40 years. He's working on making a difference in the ophthalmology space. These are some of his lectures around the world in the latest years. And also in the awards are a lot of awards since 1978. He was somebody that wanted to write the history of ophthalmology by making improvements and make a difference in the life of the patients with innovation and research and development. So here you can see his awards. And most importantly, right now is fellow, as I said, of many college and association, but most of all is the president of the VMR Research Foundation, which is really, I believe now, the most important research organization about eye floaters and vitreous disease in the eye. So I'm very pleased to have Dr. Seberg with us, but remember, the objective of this webinar is how to support the project created to connect eye floater sufferers and the Research Foundation in a single unified movement. So Dr. Seberg, I'm gonna hand you the microphone because here we're gonna describe now the 3 keys to success and why this project is different from anything ever done in the eye floater research field. I hand you the microphone, Dr. Seberg, and please let's welcome Dr. Seberg, everybody in the chat, if you can write and greet him for being with us tonight. You can.
Thank you very much, Fabio. I think this is an important slide for the audience to appreciate that there are three keys to the success of the VDM project. The first is the science, which has to represent the foundation of our approach, but also the collaboration with the VMR Research Foundation, which is the organization that's going to facilitate better treatments and evaluations today as well as tomorrow. But I think for all of you who are listening and participating, the power of a movement cannot be understated. And we are hoping to unite the community of sufferers, but also the people related to them, as well as philanthropists who are perhaps unaware of the plight of patients who have eye floaters. And so these three keys to success represent our objectives in this webinar, but also in the VDM project. As previously described, I'm active at UCLA and the Doheny Eye Institute, but also the Jules Stein Eye Institute in teaching and in research. And what I want to emphasize today is what we know about vitreous, specifically as it relates to the origin of floaters. And remarkably, vitreous is the largest structure within the eye, yet our understanding of its physiology and its pathology is perhaps least of all the different parts of the eye. And the good news, however, is that we've learned quite a bit over the years. If you consider the major textbooks that have been published over the years, going back to Sir Stuart Duke Elder, who published a monograph in 1930, it was only 72 pages long. There was no clinical information. It was just the chemistry of vitreous as it was understood at that point in time. In 1989, there was an increase in knowledge sufficient to feature a book, also a monograph, that was 173 pages long, and that attempted to unify some of the scientific information about vitreous with some clinical information. By 2002, it was no longer possible for a single author to cover the topic of vitreous, and the Rapport de la Société Française d'Ophtalmologie was entitled Pathologie du Vitré. It required 493 pages to cover the contributions of 30 different authors. By 2014, there was an increase in knowledge concerning vitreous sufficient to require a book that was 956 pages in length and authored by 90 co-authors. So this growth in the fund of knowledge of vitreous has really been exponential over recent years, and it's extremely helpful, not just for the understanding of eye floaters, but for the understanding of various diseases of the eye where vitreous plays a role. And nowhere is that more evident than in the evolution of medical therapeutics. It's an interesting philosophic point to consider that when we know nothing, we tend to do nothing. As we start to understand a disease, we tend to operate on it first. Improved understanding of disease with further increasing knowledge results in the replacement of surgery with pharmacotherapy. And the history of medicine is replete with multiple examples of what I just described. And we are on the precipice of a transition from surgery to pharmacotherapy in many different diseases of the eye, vitreoretinal diseases included. When we truly understand a disease because of the increased knowledge, we can prevent it from ever happening. And that depends upon the synthesis of the clinical sciences with the basic sciences. And I think that it's very exciting to see that happening more and more as concerning vitreous and vitreoretinal diseases. But our topic today is floaters. And I think it's important for you to realize that floaters are not structures inside the eye. Rather, they are a visual phenomenon, basically shadows that are created by opacities within the vitreous body. And that's an important distinction. Here you can see a scanning laser ophthalmoscope image of a doctor who had come to me complaining of floaters in his vision that interfered with his work. And this image shows the shadows that are cast upon the inside of the back of the eye, particularly in the central portion of the retina, which is called the macula. And you can see these dark areas represent the shadows that interfered with this doctor's vision and many other patients as well. So how does this form? What happens inside the vitreous to result in the opacities that create shadows that disturb vision and make life miserable for many people? Well, this image that was taken by me when I was at Harvard represents the appearance of the vitreous body in a 9-month-old child. And what I've done here is I've peeled off the outer layers, the sclera, the choroid, and the retina, but left the vitreous body attached to the structures in the front of the eye. This particular specimen is situated on a surgical towel and exposed to room air. And it's rather remarkable that the vitreous body maintains this gel state. But the other thing that I want you to appreciate is the exquisite transparency of vitreous. It's one of the most important functions of vitreous, and that is the maintenance of clear media in the center of the eye so that light can travel into the eye and all the way to the retina, where it results in the process of vision that ultimately ends up in the brain. It's also of interest to explore what could the possible causes of the opacities be that create floaters later in life. And there are several hypotheses because basically I think there are several different causes. They're not the same in every individual. And in recent years, I've become very interested in the concept that the origin of vitreous opacities could relate to an anomaly of embryogenesis. When you're in the embryo state, during the first 3 months of embryogenesis, the vitreous body is filled with blood vessels, such as those that you see at the top, but also on the left-hand side. And the reason is that these blood vessels carry blood from the back of the eye to the front of the eye so that it can grow and develop into normal structures. During the second trimester, months 3 to 6, the body undertakes a remarkable phenomenon where these blood vessels disappear. And understandably, it's necessary for the blood vessels to disappear if the vitreous is going to become transparent and allow light to enter the eye and travel all the way to the retina. But like all other biological phenomena, it's entirely possible that the regression of these embryonic vessels is incomplete in some people. And the hypothesis is that this incomplete regression during embryogenesis may lay the groundwork for the subsequent development of opacities that create shadows that people see as floaters later in life. Other mechanisms relate to the biochemistry of vitreous, and at the risk of going too far in detail, I want you to understand that one of the reasons vitreous is so remarkable is that it's 98% water, yet it has this gel state that's shown in the upper left-hand image due to 2 macromolecules and other more minor molecules. The major macromolecules in vitreous are hyaluronan, which renders viscoelasticity, and collagen, which represents the structural framework, almost the skeleton of the vitreous body. And there's a very remarkable interaction between collagen and hyaluronan, which is quite poorly understood, frankly, but that interaction results simultaneously in the transparency of the vitreous body, but also the maintenance of the gel state. There are changes in the interaction between hyaluronan and collagen that result in the displacement of the hyaluronan molecule from its matrix connection to collagen. And the collagen fibrils then cross-link and aggregate into structures that ultimately attain prominent proportions. This is a transmission electron micrograph of vitreous from a human showing the collection of the collagen fibrils into bundles of parallel fibers, such as that shown in cross-section and indicated by the arrow. This is, so to speak, a normal aging change, but it's something that we see with aging, and it results in structures inside the eye that do not let light travel through the vitreous body. Rather, the light scatters and it creates shadows that result in the visual phenomenon of floaters. And those microscopic changes undergo advances and progression throughout life so that they ultimately attain macroscopic proportions. What you see in the central panel, well, let's start on the left panel. What you see is the dissection of the eyes that I was taught as a medical student at Columbia by André Baloche and utilized in the early years of my research exploring the structure of the human vitreous. And in this protocol, I peeled off the outer coats, the sclera, which is the white, and then the brown is the choroid, and that's peeled back, almost like peeling the skin of a grape to expose the retina. I then peeled off the retina to expose the vitreous body as shown and illuminated it from the side with a slit lamp beam and examined from above and photographed from above, creating a 90-degree illumination observation angle which maximizes the Tyndall phenomenon. In the center panel, you see at the top the appearance of vitreous from children. The front of the eye is at the bottom, the back of the eye is at the top of all of these photographs. And what I want you to appreciate is that within the vitreous body itself, there's not much in the way of light scattering. It's rather clear. In the center panel, you see the appearance of the adult vitreous, where fibers have formed as a result of what I described earlier on a microscopic level. But by middle age, the aggregation of the collagen fibrils attains sufficient proportions that we can see this in these dark field slit micrographs. In the bottom panel is the appearance of an 88-year-old individual who has further degeneration of the vitreous body with significant aggregation of the collagen fibrils, but the associated liquefaction that occurs. The gel becomes liquid, and that's very important in understanding one of the major causes of vitreous floaters. It's the destabilization of the vitreous body that occurs when there's dissociation of the hyaluronan molecules from the collagen, and the result is liquefaction of the vitreous and destabilization. And the result of that destabilization is collapse of the vitreous body, so-called posterior vitreous detachment. And Fabio, if you could please play the video that corresponds to the image in the upper right-hand corner, our audience will be able to see the appearance of the posterior vitreous that has detached away from the retina. What you see at the bottom is a three-dimensional representation of the retina. It's the back of the eye. The white represents the vitreous body that has liquefied and collapsed, pulling away from the inside of the back of the eye. And what that does is the structure that moved anterior away from the retina is now interfering with the passage of light to the retina, creating shadows that patients see as floaters. It's important to realize that in many instances that separation creates problems with the retina, but that's not the subject of our consideration today. Rather, the phenomenon of the visual phenomenon of floaters that's created by this collapse of the vitreous body away from the retina is the subject of our concern today. And in the lower right-hand corner, you see a scanning electron micrograph representing the collagen density in the posterior vitreous that underlies the scattering of light and the creation of shadows that people see as floaters. And I've been quite fascinated by this phenomenon for many years, but particularly for the past decade. And the issue at hand is the question of whether the floaters that are created by a posterior vitreous detachment, which is the most common cause of vitreous floaters, is a nuisance or a disease. And this question has been debated within medical circles for a long time, but also within non-medical circles, because there's a disparity between what the medical profession thinks and what patients think. And I have sought the opinion of experts far and wide, and I came across the following opinion, which I'd like to share with you at this time. Fabio?
Okay, just 1 second.
Oh,
Okay,
squiggly line in my eye fluid. I see you there, lurking on the periphery of my vision. But when I try to look at you, you scurry away. Are you shy, squiggly line? Why only when I ignore you do you return to the center of my eye? Oh, squiggly line, it's all right. You are forgiven.
Could we have the slides, please?
Yes.
Unlike Stewie, who seems to be willing to forgive his squiggly line, many patients are unable to do so. In fact, studies have shown that the negative impact of vitreous floaters, according to patients, is equivalent to that of age-related macular degeneration and greater than glaucoma and diabetic retinopathy. In this study, patients felt that the negative impact of vitreous floaters was equivalent to angina, stroke, colon cancer, and asymptomatic AIDS. And as remarkable as that observation is, the following is even more remarkable. Patients who have vitreous floaters are willing to accept a 7% risk of blindness and are willing to exchange 1 year out of every 10 years of remaining life just to be rid of their floaters. And this has been confirmed by subsequent studies over the years. But that doesn't appear to be the opinion of most doctors, who feel that vitreous floaters are just a nuisance. And the question is why? And I've pondered that question for many years and come to the conclusion that it's because of the absence of objective clinical indices of changes within the vitreous body on a structural basis, but also functional abnormalities. You have to understand that doctors require tests, ideally tests that result in numbers, that enable them to diagnose a condition, but also stage its severity from mild to moderate to severe. And the absence of these clinical indices in the vitreous floaters domain limits the ability of doctors to accept vitreous floaters as significant and consider it as a true disease. And consequently, I've dedicated the past decade or so of our research to define the condition that I have named vision-degrading myodesopsia in objective and quantitative terms. There's a difference, therefore, between floaters that are just a nuisance and floaters that impact vision. But in order to make that distinction, it's necessary to have objective criteria of both vitreous structure and visual function. And so here's just an example of the multiple studies that have resulted and the publications that resulted from those studies, documenting our results to date in achieving the objective criteria. And in order to continue that work, and I'll be sharing more of the details with you later, we formed a research foundation that received IRS tax-free designation in 2019 and is dedicated to research and development of the role of vitreous in vision as well as disease, and mostly these days, the disease of vision-degrading myodesopsia. And the objectives of this research program can be found on the vdmresearch.org website. But primarily, we are very interested in improving the imaging of the vitreous body. In spite of the nice images that I just showed you, in clinical practice, there's a lack of techniques with which to do three-dimensional imaging of the vitreous body and generating quantitative indices. I'll be sharing with you our success to date of using ultrasound to do that, and improvements can be made to further our the impact of ultrasound, but we also need to look into optical means to do the same thing with optical coherence tomography or other optical modalities. It's also important to improve our understanding of these structures in the vitreous body that create floaters on vision. So far, we've had great success in evaluating the impact on contrast sensitivity function. That's the ability to discern shades of gray, and I will be sharing results with you later on. But the phenomenon of reading and driving is greatly impacted as well. And this has been described to me by many, many patients. And yet we don't have good ways to measure reading and determine how these vitreous opacities impact on reading, but also on driving. And they vary in different ambient lighting situations. And we haven't really studied that yet, but we need to. A very important component of the research program in the VMR Research Foundation is community outreach. And what we're doing today is beginning to form the community, but we need to do more public health type outreach to identify people in the community who have vitreous floaters and who may be afflicted to the point of deserving the diagnostic term of vision-degrading myodesopsia, but they don't know where to turn. They don't know where to get the proper evaluations in order to determine just how bad is their situation. And as part of this outreach, we've developed a self-administered questionnaire called the Vitreous Floaters Functional Questionnaire. And I won't go into too much detail because this is still in development, but we need more support in order to continue the development to a point where it can be used on the internet by patients at home. And that's an example of how medicine needs to evolve in the future. We need to move from hospitals and clinics into the home because that's where health begins, at the home. And we need to shift from disease orientation to health orientation. And these types of things are going to enable us to do that. Lastly, we would like to begin at least discussions, if not actual research projects with various partners at the big pharma level, but also universities and other technology companies to develop novel therapies. I will be discussing later the treatment of vitreous floaters or vision-degrading myodesopsia patients with limited vitrectomy, but I fully appreciate that in the eyes of history, that's going to be replaced by less invasive and superior technologies. But the time to start to develop those technologies is now, and we need support in order to do that. And I've listed a few of the examples of novel therapies that we're exploring and would like to explore further. Here is the IRS determination of the tax-free status of the VMR Research Foundation, and this is available on the website for your review. So to summarize, the future developments will surround education, which I feel is very important, and today's webinar is the first step. We also have materials on the vdmresearch.org website that will enable you to better understand vitreous and the condition of vitreous floaters, but specifically vision-degrading myodesopsia. And the information that's provided is scientific and not anecdotal. There's a lot of misinformation out on the World Wide Web, but in the community in general. And we hope to improve that situation by providing scientific information that will help people understanding of vitreous and this condition. But as I mentioned earlier, the formation of a community is integral to a lot of the things that need to be done, specifically raising support for research and development. So I'd like to end by quoting Fabio Gallerani, who encourages us all to join the fight and unite for clear vision. He's been a visionary in this space and is to be congratulated for making all of this happen. Fabio, I'll hand the mic back to you.
Thank you so much, Doctor. Thank you for your amazing analysis of the current situation in the understanding of vitreous floaters. And now I want to start this part of the webinar with this quote that I personally wrote, which states that a united movement is capable of achieving everything in today's world. A group of people with the same vision will make possible what was impossible before. And I'm really glad to be in this webinar, because before I was honored to be in this webinar with Dr. Seberg. All this was in my mind. And now I'm going to share my story with you, because I think you're going to find something that you can recognize yourself into it, so you can relate. So I'm going to explain you a case study about a movement that I already created and why I believe that a movement of people with the same vision can achieve everything. The All-Inners movement was born in 2017 with a purpose that I was a digital marketing expert and a professor, and I was teaching through e-learning platform these skills to enable entrepreneurs and professionals to achieve more, and also to fight the crisis or any bad situation that their business can get into. So it started with the desire to make difference in people's lives, and all-inners, as I stated before, means that you are all in and you don't have a plan B. So this movement started from zero, from a vision, and today it counts over 35,000 people. As I told you, is also a bestseller book that will be published also in the United States in May. So maybe you will have the chance to read it. But it was born with the vision of helping entrepreneurs and professionals, a mission to unite people who decided not to have a plan B in life, and also a mission to give hope and isolation from negativity to all those that believe that they deserve more in life. So I was able from scratch to create this just with the power of the World Wide Web and the power of digital marketing. And today, this is a picture of like 500 of the 35,000 people that join one of our latest events. But you can see the smiles on their faces. And I believe that this is possible also in this field, in eye floaters condition, because I see some similarities on what I already accomplished. Because I believe that we all deserve better empathy on our situation, and also we deserve improvement in the medical field. And one day we will take this picture and smile, because we will think about our journey through all these exciting projects that we are explaining you tonight. And so why did I decide to create the Vdm Project? Well, for one simple reason: to make a difference in people's lives. And in 2018, it was in the peak of my entrepreneurial career. So, when you achieve your dreams and you can live the life of your dream, and you, in the meantime, are having an impact in the life of your customer or in the life of others. I was able to have my mother retire early, thanks to my success, and I was blessed to be in a situation like that. But until that day, that changed my life forever. I remember that after one of our events, I went to take a small vacation, and it was October 8, 2018, and I wake up, and suddenly, looking at the sky, I saw this. I bet you can relate to this picture, because that day changed my life forever. Can you relate? Let me know in the chat. Can you relate on this situation? Everything is good in your life, then one day you look at the sky and you see a situation like that. It was shocking, and I know how you feel right now. You feel shocked, and you start to look around. You start to find answers. So the first thing I did was actually fall into depression. Was 8 months of depression, and in these 8 months, I decided to react after a while, because I was the founder of a movement that states that in life you have two options: give up or go all in. So the fact that I was involved in my own movement really helped me to react. And right now my target is to make you react, because you deserve more. You deserve to understand the condition you have now, but also you deserve to solve it or to cope with it as better as possible. So I wanted to understand who was striving to make a difference in research. I was looking online, and I visit many ophthalmologists in my area. They all told me it was normal, everything was fine. I didn't have PVD, posterior vitreous detachment, so everything was fine for them. But as Dr. Seberg said, that sentence maybe is not the fault of the doctor, but is the fault of the lack of evaluation methodologies that can enable a doctor, an ophthalmologist, to tell you, hey, you have this, and it's mild, moderate, or severe. So I believe we should all stop and this is an invitation I do because one of the main purposes of the VDM project is to stop the hate. Let's stop hating the medical field because they are doing everything they can for us, and you will discover it why in this webinar. After months of research online, I got to know there was an organization in California. I sent an email to Dr. Seberg because I found some of his videos, some of his research paper online. And I say, hey, Dr. Seberg, this is Fabio. I'm an entrepreneur. I am looking for somebody that is doing research. Can you give me some news? And I remember like yesterday, that email that was a very quick reply. And this is amazing by a doctor of his career, of his success. Normally, you write to somebody that has success, and most of the time they don't reply to you. And I really appreciate the fact that I got that reply that was mentioning some research about UCLA. And then in that email, there was also a PDF attached. So I opened that PDF and I was amazed. There were several research going on, but nobody in the communities knew about that. So I thought to myself, it's time to react. It's time to make a difference. So that has done much research developed in the field of eye floaters. So I just told you the story. And one day I took a flight and I traveled 9,000 kilometers. Like, suddenly when you are all in your life, you do whatever it takes to solve every problem. So then I met Dr. Seberg. In that meeting, we decided to collaborate. And this was a picture we took together in Los Angeles. It was also being evaluated with the methodology that Dr. Seberg will discuss in this webinar later on. But what I found out was that our mission was the same. And the mission is to impact positively the people, to give education. And I decided that I was going all in this project. And that day, the Vdm Project was born. So why I'm so excited about this and why I am sure this will achieve success? For two reasons that are not described in this slide. First of all, the all-inners never quit. So I really suggest you to start taking this mindset into your life to better cope with this situation, because it has helped me a lot. And right now I can tell you that this is possible, okay? And this is a big step forward to start having positivity back in your life. And then the second reason is actually this slide, a synergy never seen before. There is a medical expertise of Dr. Seberg, his foundation, and all the partners that are working on the research project. The research foundation itself, because it's important to have a research foundation which cares and which is focused on important research project that we will speak later on, but you already discovered it if you downloaded the PDF in the VDM research site. And the movement of sufferers. And I want you to start feeling part of a movement, because we are a movement right now, and we will never stop until we will win, okay? So altogether, this allows us to create a mission that I'm gonna read it to you so you have it clear and you know why you should be part of this movement and why you should do it now. We aim to connect eye floater sufferers from all over the world to give them hope, support, and positivity. We aim to financially support the VMR Research Foundation's research project to progress and find better treatments for eye floaters. We aim to educate eye floater sufferers through reliable and scientifically proven sources of information to better understand the condition and be able to positively react to it and improve quality of life. Our mission is one: unite for clear vision. And what is the vision? What is the target we are seeing right now? Is to find a better treatment solutions for eye floaters. And we aim to create a worldwide pressure group and support the VMR Research Foundation to make progress towards a better tomorrow. VMR Research is a non-profit organization established by Dr. Seberg that strives to refine modern diagnostic and treatment regimens and develop new approaches based on enhanced understanding of the role of the vitreous in health and disease. And also, the vision can be achieved by raising funds. for the continuation and expansion of the R&D, research and development agenda of the VMR Research Foundation. The plan is simple, and I'm gonna explain it to you in a few slides, and it's very important you understand that we should go through the phases. If we all unite, this can be possible in 2020, okay? This is 2020, as Dr. Seberg said. 2020 is also a definition where an ophthalmologist tells you that you have a perfect vision, you have 20/20 vision, and this is the year, okay? So phase one is to launch the vdmresearch.org, reaching 10,000 people in the newsletter. The phase two is to help the VMR Research Foundation for specific research project in the PDF. And the phase one and the phase two can work together, okay? They are working together right now because we are almost achieving the phase one with the 10,000 people in the newsletter. Phase three is to create a huge pressure group to influence pharmaceutical companies and get support from institutions. Pharmaceutical companies, they want to see us united. They want to see that we want to solve a problem because they have to invest massive amount of money in developing cures, approaches, and they have to have the funds to test these new approaches. The phase four is develop a better treatment approach for eye floaters and especially focus on prevention, because as Dr. Seberg said, when we really understand the disease, we should focus on prevent it for ever happen, as Dr. Seberg said. So the phase one, as I say, 10,000 subscribers, then support the VMR Research Foundation. And also is important because the vitreous has been overlooked as important. And Dr. Seberg is our voice in the medical field to continuously saying in the latest years that vitreous is not just a gel that serves as some piece of the eye that is useless. The vitreous is very important for the health of the eye and should be deserve to be considered very, very important. The VMR Research Foundation, as you said, was established in 2018, and we aim to develop new approaches based on enhanced understanding of the role of the vitreous. So, Doctor, I want to hand you the mic just to describe just a little bit about these institutions that the foundation is working with.
Thank you, Fabio. The reason to include this slide is to emphasize to the audience that no man is an island unto himself, and that we do a lot of our work in collaboration with outstanding collaborators at Harvard, at Columbia, in Australia, in California, in Poland, Belgium, and Spain, as well as Ireland. And it's simply a way to recognize our collaborators and thank them for their contribution to our work. And hopefully with the support of the VDM Project, we'll be able to further collaborations with these individuals as well as other institutions. One of our target organizations is the technology sector, the laser companies, the diagnostic companies, but also big pharma, because as you'll hear shortly, drug therapy may be in the future. And as we mentioned earlier, an increased understanding of the pathophysiology of diseases enables us to transition from surgery to pharmacotherapy. It's a more intelligent approach to the problem, although surgery is remarkably successful at this point in time. So the creation of a pressure group in phase 3, as Fabio was describing, is the byproduct of phases 1 and 2, and perhaps you want to take over, Fabio.
Yes, so as I say, we should unite because we are a lot of people. And yesterday I was in a meeting with some people, and I always ask this question. I say, can you look at the sky and tell me what do you see? And they say, yeah, I see some like lines moving. And I say, you know what? These are floaters, and one day they should turn black. And this is a statement that may happen or may not happen, you know, but we need to understand, And for this reason, we need to improve evaluation, especially ways to evaluate if somebody has the condition or not. And of course, as Dr. Seberg said, what is the gravity of it, mild, moderate, or severe? But also we need to understand that we are many people. And if we unite, the success will be a consequence. So phase 3 is very important, and we are starting right now. So if we start right now, we will complete phase 3 very, very fast. And then phase 4 is develop a better diagnostic to enable enhanced treatment, which is the final target. Many people ask, how can we cure this? How can we treat this? But as Dr. Seberg said, and this makes perfectly sense, we need to start understanding the disease before developing new treatment. So the diagnostic part is the focus right now. So doctor, before I am gonna hand you the mic, I'm gonna just finish this part of the webinar speaking about the Mastermind Group, because in the VDM Project, we are already with other sufferers, we are volunteers working 24/7 in an organized environment. This is a Trello. Trello is a task management tool which enable the Mastermind team, which you can be part of, to share ideas, to be part of the VDM project. And at the end of the webinar, I'm gonna explain you how you can be part of this Mastermind team, because I believe if you have, if you are willing to help, you should be able to help. This is an open project. This is a project where nobody is a boss. I am the founder, I am the visionary, but I'm not the boss or anybody more important than you. So I really invite you, if you're watching this webinar, you want to make a change, you want to have an impact, to unite with us also in the VDM Mastermind Group, and I'm going to tell you later how to do so. And we have a clear target in mind, making eye floater recognized as a disease of the eye and pushing the medical community to unite with Dr. Seberg and find a better treatment for eye floaters condition, which depends upon better understanding, better imaging for personal evaluations. So, Doctor, I hand the microphone to you, and we're going to see some case studies of the current situation and the future developments.
Thank you very much. Case studies are valuable because they are poignant examples of individuals and how changes have impacted their lives. And so I will address a couple of those, but the true information that doctors use to form their opinions and shape their approach to patients is an evidence-based approach. And to have evidence-based data requires large numbers. And I'll be sharing with you some of the information that we have garnered from relatively large clinical studies. And the reason for this slide is to describe the fact that vitrectomy is the current standard of care to cure these conditions. And what I want to do before I get into vitrectomy is go to a video. Well, we don't have that video at this point in time. So let me go back and just continue the train of thought. Vitrectomy is something that seems to be scary for a lot of patients. And I want you to appreciate the fact that I'm here representing the medical community, sometimes uncomfortably because of their lack of empathy and their lack of understanding in general of the importance of vitreous, but its role in creating eye floaters that can sometimes be so disturbing to vision and denigrating the quality of life for many sufferers that it's truly a disease deserving of the diagnosis vision degrading myodesopsia. And today we treat that with limited vitrectomy. And in order to dispel some of the misunderstandings, I want to share with you that this is something that was developed by Robert Mackamer and Jean-Marie Parel at the University of Miami in the 1970s. And it's become a mainstay of routine clinical care throughout the world. In 2019, there were 1.8 million vitrectomies performed worldwide. The majority of those were not for vitreous floaters, although a recent study suggests that about 7% of vitrectomies, at least in the United States, during recent years, were performed for vitreous floaters. The success rate across all diseases is extraordinarily high, and it's very, very safe, as I will share with you in a specific study on patients with vitreous floaters. The imaging issues that Fabio raised are critical because they not only will improve our understanding of the disease, but it also will improve our management of patients who have this disease. And what you're looking at now is a combination of a standard clinical test called Optical Coherence Tomography. That image is in color up at the top. It represents a cross-section through the inside of the back of the eye. And in grayscale at the bottom is scanning laser ophthalmoscopy of the same doctor that you saw earlier, who has shadows cast upon the retina by the opacities in the vitreous. At the top, that structure that you see referred to as FL is the vitreous opacity that creates the shadow, because the light can't get through the opacity without scattering and creating shadows. And so you see the dark space on the color image. That represents the shadow induced into the optical coherence tomography image, but also down at the bottom you can see shadows cast upon the macula in scanning laser ophthalmoscopy. These are very nice qualitative representations, but to date, no quantitative data can be extracted from this that would be helpful. Here again is the image of the doctor with opacities that create shadows on the macula, and here you can see the postoperative appearance following a limited vitrectomy, which is a 10-minute procedure done under local anesthesia in an ambulatory surgery setting with discharge home on that same day. That patient was extraordinarily happy. He was one of the first ones that I did many years ago. And my experience in this domain has increased because, like anybody else, I was rather hesitant at first, because 20 years ago, I used to say the same thing to patients that is being said by most practitioners today. And Fabio alluded to that. We check the eye thoroughly, we don't find any disease of the retina, and we tell the patient there's nothing wrong, you'll get used to it. And there are many patients who do get used to it, who are able to cope. But there are also a large number of patients who are unable to cope. And they've been mistreated. They've been misunderstood. And I'm the first to say that we have failed. At the very least, we have failed to understand the plight of those patients and be sympathetic to that and consider their situation like we would consider any other patient. Patients with clinically significant floaters, what I call vision-degrading myodesopsia, deserve the same respect and consideration that any other patient with any other disease has. And it's the mission, or one of the missions, of the VMR Research Foundation and indeed the VDM Project, is to raise awareness and understanding within the medical community so that there will be more empathy to patients who are suffering from this condition. But it has to be based on scientific data that lends to an understanding before we can have the paradigm shift that the medical community needs to undertake. Furthermore, having available a treatment enables us to test the hypothesis whether or not the vitreous is the cause of the problem. We believe it is, but we also have scientific data to prove that it is. And as I mentioned earlier, evidence-based approaches are not based on a single case here and a single case there, but rather they're based on a large group of patients. And so we were able to assemble 195 eyes in a large number of patients who had vision-degrading myodesopsia and underwent vitrectomy with limited vitrectomy with minimally invasive techniques sutureless surgery with self-sealing wounds, and preservation of the vitreous behind the lens to mitigate against cataract formation, and without inducing a posterior vitreous detachment surgically, which is very often the way vitrectomy is done. But my approach has been to minimize risk and not incur the iatrogenic damage to the retina that can occur when you forcibly pull vitreous off of the retina. And that also contributes to the formation of cataracts, which we wanted to avoid. The etiology of vitreous floaters is shown in the lower left-hand part of this slide. Half of the patients had a posterior vitreous detachment, the phenomenon I described earlier, where the gel has liquefied to the point of instability that allows it or enables it to separate away from the retina and collapse. The back surface that was attached to the retina is now floating in front of the retina, creating the sensation and the visual phenomenon of floaters that patients are very well aware of. The mean age of the group that had posterior vitreous detachment as the cause of their vitreous floaters was 63. The second leading cause of vision-degrading myodesopsia is myopia. Nearsightedness is associated with structural changes inside the vitreous body that are very similar to what we see in aging, but happened some 15 years earlier in life. And the more nearsighted the patient, the more these changes occur and the earlier they occur in life. So the mean age of the patients who had vision-degrading myodesopsia due to myopic vitreopathy was 41, statistically and substantially less than the mean age of those with posterior vitreous detachment. And there was a very important subgroup of patients who had myopia and posterior vitreous detachment. And with the assistance of the VMR Research Foundation Research Director Justin Nguyen, we are currently analyzing a series of patients with myopia and discovering that the most unhappy people in our clinical experience are myopic patients who also have a posterior vitreous detachment. And there are specific reasons for that, which we're identifying in this research and analyzing to the point of writing a paper and publishing and sharing it with the worldwide community. Our outcome measures are listed on the right. The National Eye Institute developed a questionnaire called the VFQ. It stands for Visual Functional Questionnaire. It's a general questionnaire about vision, and it's not intended to specifically query the impact of floaters on vision and quality of life. But because it's the quote-unquote gold standard, we utilized it in all of our patients. We performed quantitative ultrasonography and measured visual acuity, which is the standard measure of vision, just because that's important, although it's really not very valuable as a way to assess the impact of vitreous opacities on visual function. Contrast sensitivity function, however, has turned out to be an extremely informative way to understand what impact these vitreous opacities have on the vitreous body. In terms of efficacy in these 195 cases, we found that satisfaction was substantially improved, at least statistically significantly improved. General vision improved by 30% and role difficulties improved by 32%. I have to share with you that my impression is that these are drastically underestimated. And I believe it's because the limitation in the Visual Functional Questionnaire, which is a general questionnaire not specific to vitreous floaters, is not really capturing the experience. The happiness factor in the patients who I have treated is off the charts. It's really quite remarkable. And it substantiates the concept that vitreous was the cause and that these people were not imagining things. They were experiencing some life-altering changes that we have not adequately addressed up until recent years. Quantitative ultrasonography showed that structures in the vitreous body greater than 0.07 millimeters in diameter were decreased by 94%, and that's rather substantial. Visual acuity improved statistically from 2030 to 2025, but that's not really a clinically significant improvement. Contrast sensitivity function, however, improved in all cases to a significant amount. And this graph demonstrates for you the level of contrast sensitivity function in the 139 patients with floaters who were measured preoperatively. They are indicated in the second bar that's labeled floaters. The controls, which are a group of age-matched individuals who do not have vitreous floaters, are shown in the first bar on the left, and the y-axis represents contrast sensitivity function. And with the test that we employ, the higher the contrast sensitivity function number, the worse the actual contrast sensitivity function. So that on the y-axis, the percent W, that's the Weber index, is a representation of contrast sensitivity function. The higher the number, the worse the function. Therefore, as you can see in the first bar, the average contrast sensitivity function of people who do not have the visual phenomenon of floaters was 2.4. Patients with clinically significant floaters, what we call vision-degrading myodesopsia, had an average contrast sensitivity function of 4.5. That represents a 91% degradation in contrast sensitivity function in this patient population afflicted with vitreous floaters. 1 week after limited vitrectomy, every single case was normal. And that's the third bar that you see from the left. And that improvement was back to the normal range, equivalent to what patients who do not see floaters had. That's the first bar on the left. And all the other bars represent repeat measurements at 1 month, 3 months, 6 months, 1 year, 2 years, 3 years, and 4 years. The normalization of contrast sensitivity function, which was both statistically significant but also clinically significant, was sustained for many years. And after we finished this study and published the results, we continue to follow the patients, and they continue to be ecstatic. Well, a lot of people are afraid of an invasive procedure because of the risks. And some of the doctors who do not ascribe to the acceptance of vision-degrading myodesopsia as a disease are hesitant to offer vitrectomy for fear of complications. And let's face it, complications do exist, but not at the level that is often touted by the critics of this approach. And in this series of 195 cases, we had a mean follow-up of 32 months, but a very substantial number of people were followed for much longer. There were 50 cases followed for more than 4 years, and 22 cases followed for more than 5 years. That's rather unusual in clinical research. To have such a large group of individuals followed for such a long time provides significantly important information. No cases of infection occurred in any patients. There were no problems with intraocular pressure, no glaucoma, and no low intraocular pressure. Out of the 195 cases, there were 2 people who experienced bleeding inside the eye immediately after surgery. But the bleeding was not significant, and it cleared spontaneously without a need for any further surgery. 1 patient experienced macular edema. There were 3 patients who experienced a retinal break, a tear in the retina. It was identified, and it was treated successfully in each cases, and further progression was prevented. There were 3 cases of retinal detachment, which represents an incidence of 1.5%, significantly lower than has been described in the past. And that's, I believe, because of a very careful, meticulous preoperative evaluation and treatment of any high-risk lesions prophylactically, but also the avoidance of inducing a posterior vitreous detachment surgically during surgery, pulling the vitreous off the retina, has lowered the incidence of retinal detachments. And each of these 3 cases was successfully treated and ended up very happy. There was a symptomatic posterior vitreous detachment in 4 people who did not have a posterior vitreous detachment prior to surgery. Recall that I don't induce a vitreous separation during surgery, and 4 people experienced the return of floaters following this procedure, because in those individuals, the posterior vitreous separated away from the retina. They were sufficiently bothered, and their contrast sensitivity function, which had become normal after the limited vitrectomy, once again reduced to a level that justified a repeat operation. And that was done without any complications in all cases, and they returned to normal levels of contrast sensitivity function and were very happy. 4 cases is really not very many. There were 2 cases of macular pucker that required surgery, which was successful. And then there were 4 people who had occlusions of the blood vessels of the retina. There is really no reason to suspect that the vitrectomy had anything to do with that. But in the spirit of full transparency, I share that information with you. These were all older individuals who had high blood pressure, which is the most common cause of vessel occlusions in the retina. A lot of people who are considering vitrectomy are concerned about the subsequent development of cataracts. And let me start and share with you from the outset that yes, an eye that has had a vitrectomy will ultimately develop a cataract and require cataract surgery at some point in time. But employing the limited approach that I've described, it turns out that with a mean follow-up of 32 months, this patient population had a cataract surgery incidence of 16.9%. And the mean age of these individuals was 64. No individual under the age of 53 has required cataract surgery, and we're now 6-7 years out in the follow-up of this patient population. We did do a specific study comparing our technique with that at the University of Amsterdam, where they perform an extensive vitrectomy, and the results are shown in the red line up above, and the limited vitrectomy at the VMR Institute is shown in the blue line at the bottom. On the y-axis to the left is the percentage of eyes that required cataract surgery, and on the x-axis at the bottom is the time frame. This study looked at all people who had 24 months follow-up, not as long as the study that I just described during the preceding slides. And what you can see is that the development of cataracts that needed surgery at the University of Amsterdam following extensive vitrectomy attained the levels of 80% or so, and required surgery on an average of 7 months following the vitrectomy. On the other hand, limited vitrectomy only had about a 35% incidence of cataract surgery at 24 months. And it took about 13 months before these individuals required cataract surgery. So the hypothesis that we can reduce the incidence of cataract surgery following vitrectomy by modifying the technique of vitrectomy surgery appears to be substantiated, at least on the basis of these 2 studies. So, in conclusion, vitreous opacities that induce the visual phenomenon of floaters can have a significant negative impact on the quality of life. And we believe that's because of the reduction in contrast sensitivity function on average of 91%. That's substantial. There are not that many things in medicine that attain that prominent proportion. We believe that the use of contrast sensitivity function measurements and the performance of quantitative ultrasound will give us the objective quantitative indices that are needed to make the diagnosis of vision-degrading myodesopsia and convince the medical community that some of these cases are truly a disease and deserve to be treated differently than what we've done up until now. And the Visual Function Questionnaire and presumably its replacement by the Vitreous Floaters Functional Questionnaire will enable us to better define vision-degrading myodesopsia and will provide useful clinical metrics, not just for case selection, but also for the development of future diagnostics and therapeutics. Right now, limited vitrectomy appears to be very effective, as I've described in detail, but it also has few short-term and even fewer long-term complications. Therefore, it's safe. At least one could say it's safe enough to achieve the goal of modern medicine, which should be to help people die young as late in life as possible. Fabio, could you roll the video on this slide, please?
Yes.
Here what we see is an ultrasound of a patient who has a posterior vitreous detachment. The front of the eye is to the left, the back of the eye is to the right. And that line that you see in the black area in the center represents the back surface of the vitreous body, which was attached to the retina but collapsed forward and is now interfering with the passage of light from the front of the eye to the back of the eye for vision to occur. Can we go back to the slides, please?
Yes, 1 second. Okay, here we go.
So you can see that we utilize ultrasonography extensively, and I want to thank my collaborators at the College of Physicians and Surgeons at Columbia University, but also at Riverside Research. Jonathan Mamou has been instrumental in doing the calculations that enable us to quantify the degree of echo density in the vitreous as an index of the severity of vision-degrading myodesopsia. But we can do more. And we can improve upon this if we have enough support and enough will to develop ultrasound even further. But there's great potential in using optical approaches rather than acoustic approaches. And in particular, I'd like to see the development of three-dimensional optical coherence tomography, which would also provide quantitative indices of the opacities within the vitreous body, such as those that are shown on the right. And Fabio, if you could roll the video on this, our audience will be able to see. Once again, the back of the eye is at the bottom,
Dr. Seberg,
and the center
of
is the
the
vitreous.
VMR Research Foundation,
Yes.
interpreting images that were taken with a spectral domain optical coherence tomography system that is able to render 3D imaging of the inside of the back of the eye. What you see at the bottom is a block section that was created optically of the wall of the eye. At the very bottom is the sclera, above which is the choroid. The interface between the choroid and the retina is demonstrated by bright white lines, and the uppermost layer is the retina, which lines the inside of the back of the eye and acts like a film in a camera, receiving the light that was focused by the structures in the front of the eye and transforming those photons into electrical signals that are transmitted to the brain where vision is completed. The saucer-shaped dimple in the center represents the Fovea Centralis, which is the center of the macula. That's just the name for the central portion of the retina. The macula is responsible for small detailed vision and straight ahead vision, and is often described as the most important part of the back of the eye. In front of the macula, you can see many dark structures, which represent opacities in the vitreous body. In this instance, they are organized in clumps as well as linearly, and this is most likely the result of myopia or some inflammatory condition of the eye, as well as some effects of aging, although this is not the typical appearance of an aged vitreous in an elderly individual. These structures will interfere with the passage of light to the back of the eye and create shadows that will be seen by the patient as floaters. The advantage of this particular imaging system over conventional imaging systems is that we can not only visualize the back portion of the vitreous, that area that's right in front of the macula, but also some of the central vitreous structure. The reason that's important is that conventional OCT imaging will not visualize many of the opacities inside the vitreous body that will create the sensation and visual phenomenon of floaters. Ultrasonography can image these structures and has been successfully used to evaluate patients complaining of vitreous floaters, but the resolution of sound is not as good as the resolution of light. Therefore, this imaging is superior, although the optics limit the extent of the vitreous body that can be imaged and visualized with this technology. Furthermore, this is simply a graphic illustration of the opacities, and there's no quantification of the number or size of the opacities in the central vitreous. And that would be very important for us to be able to better understand the disease process in patients who have vitreous floaters. Using light rather than sound more closely replicates the experience of patients with floaters and can image for us the structures that create the shadows that patients see as floaters. Furthermore, a need for quantification exists because in order for us to be able to gauge the severity of disease, at least on the basis of vitreous structure, it would be very useful to measure the number and size and distribution of these opacities to get a better understanding of what's going on inside the vitreous bodies of patients afflicted with vitreous floaters. When these floaters demonstrate structural abnormalities, such as the ones seen here, and are associated with visual dysfunction, in particular degradation of contrast sensitivity function, then the term to apply is vision-degrading myodesopsia. These are the types of patients who benefit from surgical intervention with limited vitrectomy, although other treatment modalities are being sought. Surgical intervention with limited vitrectomy, although...
Okay, we can go back in the presentation.
Yes, please.
Here we go. Yes.
Here's an example of one of the projects that the VMR Research Foundation is involved with. It's in collaboration with optical engineers in Poland and in Spain. We've had two presentations at the Optical Engineering Society in 2019 and 2020. And rather than go into the details here, I'm going to share with you these images of vitreous in patients who have structures within the vitreous body that are very nicely demonstrated with optical coherence tomography. The thing I like particularly about these images is that it seems to confirm what I mentioned earlier in this webinar. The vascular structures within the embryonic vitreous may represent the harbingers of problems in the future with the formation of opacities that create the shadows and the phenomenon of vitreous floaters that can sometimes lead to vision-degrading myodesopsia. There's a lot more work that needs to be done. In particular, this needs to encompass a larger, if not the entire, vitreous body, but also in 3 dimensions and provide quantification. But we're beginning the work with advanced optical systems that will improve the diagnostics of today. But this will also improve therapies of tomorrow. If you have a really good imaging system, it can help to guide laser treatments. Currently, a lot of people are trying YAG laser. There's absolutely no proof that YAG lasers work. And this has been described in the literature on more than a few occasions. But if we were to improve the application of the YAG laser and specific areas are treated that imaging has shown us need to be treated, and then the XYZ coordinates can be defined and it can be targeted therapy, we may be able to reduce the level of laser energy and improve the impact of those laser treatments. But there are other lasers as well, such as femtosecond lasers and beyond. It's just a very expensive undertaking, and we need to motivate the laser companies to try to improve their delivery systems in an attempt to improve laser treatments and maybe obviate the need for vitrectomy. Many of you have perhaps heard about the nanoparticles in combination with laser. There too, better imaging would help us develop that technology. It's important to realize that so far all we've done in collaboration with the scientists at the University of Ghent is proof of principle. There are a lot of experiments that need to be done in vitro and then in animals and then ultimately in humans before this is available for prime time. But as we've previously mentioned, the development of better imaging with quantitative indices will provide useful outcome measurements for drug development, because you need to have some basis with which to evaluate the efficacy of any treatment, and specifically with drug treatments intended to break down the opacities and dissolve them if possible, so that they no longer interfere with light transmission through the vitreous body to the retina. So these are all exciting prospects that we are undertaking, and are looking forward to support from the worldwide community and their participation in various different ways. That concludes the last portion and leads us to the question and answer sessions that some of you have submitted prior to this webinar. The first question is, what is the most promising needed research field to better treat eye floaters in the near future? I think I've addressed that quite well in the previous slide, showing how imaging is going to improve evaluations today, but also facilitate the development of treatments in the future. So I would focus and plan to focus on better imaging at the present point in time. The next question is, why eye floaters are not considered a disease by the pharmaceutical companies, and how can we have the medical world care more? This too has been addressed earlier. The pharmaceutical industry is not going to lead, rather they tend to follow, meaning input from medical practitioners is a very useful way to motivate pharmaceutical industry to look at a situation. They will then do their market research to determine how large is the market and how great is the need and how effective can the impact be, and what is the monetary consideration, how much profit can they make if they spend X dollars in R&D for a payoff in the future. And that sort of gets back to what I was describing earlier, this community-based approach to try to get a better understanding of the prevalence of vision-degrading myodesopsia throughout the world. We don't really know that today. We don't really know what percent of the human race has vitreous floaters so significant that it degrades contrast sensitivity function and qualifies as vision-degrading myodesopsia. That kind of data could be useful in motivating drug companies to spend R&D money and develop better diagnostics and better therapeutics. What causes floaters in young individuals? As I described earlier, I believe that there is a role for the abnormal or incomplete regression of the fetal vasculature that exists during embryogenesis. But that's a hypothesis, and there's a lot of work that we need to do to further develop that. What we do know is that young individuals complaining of vitreous floaters tend to have myopia, and they tend to have moderate to advanced degrees of myopia. And the interesting thing is that myopia is actually a developmental anomaly, similar to what I was just describing about incomplete regression of the fetal vasculature of the vitreous. So there may be a relationship between myopia and the vasculature, but a lot more work needs to be done in order to adequately answer this question. We have insights and we have ideas, but we need to do the work to develop it further. What is needed in order to access big funding to fund floaters research? Typically, the way that big funding is made available is on the basis of preliminary data. You have to have some seed funding, either from angel investors or philanthropists, who will give us the opportunity to generate the data that will excite laser technology companies, imaging technology companies, and pharmaceutical companies to get interested in this problem and devote their R&D dollars to improve our understanding and improve our management of patients with this condition. So I believe that that concludes this webinar. And before handing it over to our hosts, I want to emphasize to you that although the medical profession has been callous and lacked understanding and appreciation for the plight of people who suffer with vision-degrading myodesopsia, that's changing. I'd like to think it's changing in part because of the work that we've done, but I think that the VDM Project is dedicated to changing that further and disseminating information throughout the medical community that will enhance understanding and change the approach of doctors to patients with vitreous floaters. And with continued research and development, we'll get even greater understanding and begin to show how developing technologies and drugs and lasers to improve the diagnostics will lead to better therapeutics. And hopefully it leads to a financial gain for the companies. But I'll tell you what, even if it doesn't, there'll be a significant gain in the quality of life of many people throughout the world. And that is a very exciting and satisfying prospect for me and for Fabio as well. So we hear you, we feel you, and we're willing to do the work and encourage your support of our approach to this problem. And again, I'd like to close by thanking Fabio for organizing this webinar and for all of you to be in attendance. Thank you.
Thank you so much, Dr. Seberg, for the amazing presentation. To conclude this webinar, we're going to accomplish the target that we have announced at the beginning, how to help this project. There are several steps we can do. The step one is subscribe to the newsletter for the purpose to have this pressure group, because we would like to keep the movement informed about the developments in the several research projects that the VMR Research Foundation is developing. So if you didn't subscribe, please do so by going to the vdmresearch.org website. You will receive the PDF that I originally received in the email, where I was trying to find someone researching about eye floaters. You will receive this PDF with exactly what the VMR Research Foundation is developing in the research projects. You can, in this PDF, you will see exactly these specific goals. That are 10 goals. Some of them are not related to the eye floaters, but most of them are, such as you can see improve vitreous imaging, the goal number 1, elucidate the molecular basis for vision-degrading myodesopsia, develop effective methods to detect VDM in a non-clinical settings, which is critical, because I personally believe that we all experience eye floaters outside in the real world with the bright light of the sun, and develop clinical methods to diagnose and characterize the vision-degrading myodesopsia, and evaluate the impact of eye dominance in the clinical severity of vision-degrading myodesopsia, refine treatment strategies for the vision-degrading myodesopsia, analyze cost-effectiveness of surgery, educate and raise public awareness, and the goal number 8 is our task in the VDM project to raise awareness altogether, spread positivity in the internet, let people know, let people that join the groups know that we are here, we can keep living the way we were living before by understanding that this is a disease of the eye, most probably in the VDM case, but we need to react positively by uniting and collaborating in this project, investigate vitreomacular diseases, and enhance drug delivery to the retina and optic nerve via vitreous. So you can see this is an ambitious agenda, so please subscribe and get the PDF so you can learn more about the project. The step 2 is to support the movement. You can do so by share the Vdm Project mission in Facebook groups, by connect with other sufferers and spread the word. You can tell them that this project is in place and is in place for them, so they don't have to be depressed. I wish I had this project when I was depressed for 8 months. This is really needed for people that get eye floaters and start to join groups in Facebook, to see all the sadness, and that's very dangerous also for the way that these may develop in depression and all other psychological disorder. Spread positivity and hope instead of pessimism and negativity. And please, if you see somebody pessimist and negative, please just tell them that the project is here. But if you see they keep spreading hate, please notify the administrator of the group and let them know about this. We need to do a very deep work in the Facebook group to change the pattern and improve the positivity, which will lead to better expectation and, of course, to better results. Have people complete the step 1 of the Vdm project. So if you know somebody that just got eye floater or they just joined a group in Facebook, please let them know about this project, let them join the newsletter, interact positively on social media and share this website. Please don't spam the link, because Facebook is not happy when we spam link around, because it looks like we're spamming. So Facebook may ban the website. So please do not spam it, just share it in a positive way. Help us finding institutions and big donors to support the foundation. This is achievable right now. So if you believe you have connection, if you believe you know philanthropists that they want to help, foundation, institution, they may be interested in this development, please contact the VDM project team at info@vdmresearch.org. You can find the website, but basically you can reach out to me privately, either in Facebook, in the groups, wherever you want, because we need to get in touch with other important donors. Join the Vdm Mastermind team to be more involved if you want to make a difference and be an active part of the project. You can do so by going into the website. In the news section, there is a post where you can apply for the Vdm Mastermind team. What we look for is to be committed and to bring positivity. Please do not apply if you do not want to collaborate or you want just to spread negativity. We don't really welcome that, but you are welcome if you have ideas, if you have connection, if you want to spread the positivity in the groups, even if you want just to help in the Facebook groups. The reason why we did not open a Facebook group of the Vdm project is because we don't believe doing that will help. We need to help other groups. There are a lot of groups that are full of negativity. We need to shift that momentum and bring back positivity. By doing that, it will be added to the Vdm Project Mastermind Group. Yesterday, we did a call. We do several calls every month. We keep you updated, and you will have closer access to the news before we announce them. And please, just to let you know, if you join the newsletter, we will just notify you with updates. These data are not used for anything else beside notification about webinars, about new articles, and about new improvements of the Vdm project. And the step 3, the most important, support the foundation. As you have seen, this is a non-profit organization recognized by the government. So please, we just in this moment reopen the donations, and you can do so in 2 ways. The first way is to go to the website, click donate, and then you will end up in this page. Just to let you know, the recurring donation is not mandatory. There is also a one-time donation option, but the recurring donation will give you access to the Vdm Mastermind Group, because we believe that if we create a mastermind group, we must be committed ourselves. So the first thing I will do when I finish this webinar is to check if everybody is committed, because a leader have to check if the other leaders and the people that want to contribute, they are giving before asking. So there are a lot of benefits by doing that, and we prepared a section called the VDM Education with further articles and videos and important resources that are available to the people that really support the project. And these are some of the benefits. You will get a lot of updates, and we plan also for the most committed members and people, we plan to do a Q&A webinar and some more initiative. But if you want just to help the foundation by donating once, remember that, as you see in the arrow, the amount of your donation may be tax deductible completely. So please, you can check with your tax advisor. This is a case for philanthropists and people that want to donate large amounts. You can contact directly info@vdmresearch.org, and you can get in touch directly with the foundation, but also you can do the one-time donation. We believe this is important for people that just want to be part of the project and they want to feel part. They are doing something for it. Either you can donate $1 or $10,000, doesn't matter. You can do a one-time donation, and this will be really appreciated. Unfortunately, in the field of research and development, the need of funds is really critical. So as soon as we unite and we support the foundation in the best way, as soon as we can get better results, and of course we can get more awareness and more attention. I want to let you know something that I didn't include in the slides, that Google is supporting the project. Google is granting us the budget to do advertising on Google. So if you are located in the United States now, you can search on Google eye floaters. You will see the advertising provided by Google for free. They did an evaluation of the project of 3 months. And after this evaluation, they decided to support the foundation. This is also a guarantee that this project is here to stay. And one last important thing is that all the donations are going directly to the VMR Research Foundation, and the donations are not intermediated by anybody. My role as a visionary, as a founder, is to inspire you. I'm a volunteer. I try to help the project as much as I can in the time I have beside my entrepreneurial activity. And just to let you know, we work tirelessly 24/7 to launch this project in the best way. So we thank you very much for being with us. I'm gonna stop the slide presentation and go back in the video, just to thank Dr. Seberg for being with us. It's an honor for me to working with you. As a visionary, when I took that flight and came to California, I had the vision that we will collaborate, but without your willingness to help and to educate with scientific information the community of sufferers from eye floaters condition, this was not going to be possible without your positivity and also willingness to help others in a really amazing way. So thank you, Dr. Seberg, for being with us in this journey.
It's been my pleasure, and I'm looking forward to bigger and better things to come.
Thank you, everybody, for have attended this webinar. Please visit the vdmresearch.org website to support the project and be part of it. Thank you so much, and let's make a difference. Let's unite for clear vision. Bye-bye.